talk about a little bit about public health and how that translates to dealing with sexual and partner violence. And then we found out we only had an hour. And then we found out that it was the same week as the sexual violence prevention conference that we just had on Tuesday and Wednesday this week. And so we were planning to bring local programs to talk about some of their work, and it just didn't all work out. But we're going to try in half an hour or less to frame what we're going to talk about and then sort of have a dialogue with you about what we're trying to do. And so by the end of this, we want you to be able to identify the 4 steps of the public health model or the public health framework. Prevention definition being a context of the public health approach. So you're understanding how we define prevention. To identify 4 of the 10 principles of empowerment evaluation, and to identify 4 of the 10 steps of getting to outcomes, or GTO, and learn how we're translating all of this into preventing sexual and partner violence at this stage.
So we wanted to start by just talking about the public health approach to prevention. Are people familiar with this already? We're going to think of that or a little bit new. My background coming into sexual assault prevention was actually crisis services. I did a lot of crisis work originally, and then when I came to the Department of Health, was really pretty excited actually to hear about the public health approach, which really brings some context to things that we're already doing, but it kind of puts it into place in a way that works really well. Basically, with the public health approach, you want to start by defining the problem, with the bottom left-hand screen there, and that's looking at the data and getting a sense of the magnitude of the problem. If anybody was here earlier today, there was a workshop on data with violence, family violence, child violence, elder abuse. And so if you're here for that, you've heard how complicated it is with these issues. There's a lot of things that get in the way of really either getting good data in the first place or really being able to make sense of it when you do get it. And we can talk about that more later. But it's a starting point that you can find out what data exists and what does that tell us about the extent of the problem.
Just because I'm not certain, but what exactly is the partner violence? What is it?
So you're looking at, okay, well, so when we're talking about intimate partner violence, we're talking about violence that occurs between 2 people, and one of them has power over the other. So, and when we're talking about intimate partner violence in this context, we're talking about any kind of relationship, including, I mean, we've expanded the definition to include first dates, you know, so that there might not be a whole progression of what we classically call domestic violence, you know, where there's that long history, but we're standing to eliminate all of that violence. So from first dates to relationships with long history. And it would be all-inclusive of all kinds of partnering, you know, so heterosexual,
2 adults?
It could be 2 adults, 2 young people, you know, we'll drop that age down to like 12, 11, 12-year-olds, so that, you know, if they're dating, right, they would be included.
And then it's also inclusive of a variety of forms of violence, would be the other side of that, but it could be
sexual, emotional,
emotional, physical,
spiritual, all of those things, and we would include sexual violence in that, you know, not to exclude it, because I think sometimes we get siloed into thinking of domestic violence as not sexual violence, you know, so we want to be really more and more coming from a kind of a human rights approach.
And then sexual violence might be a part of intimate partner violence, as we just said, but it could also include things like sexual harassment, you know, stalking, stranger situations that don't have that component of familiarity between the 2 people involved. Probably some things that would be, you know, in the gray area in between. But
yeah, thanks for asking that, because often we'll assume that walking in people are thinking thinking in our same terms. So really, thanks for that question. And you know, if you have a question as we're going along, please ask it, because it's more interesting to dialogue with you than the applicant.
So the second step of the public health approach is to look at what are risk and protective factors. Risk factors would be characteristics that increase the likelihood that a person would become a victim or a perpetrator of violence, and protective factors would be things about that person that might protect them from being a victim or perpetrator. And one of the things I particularly wanted to say at this point here is that people are always quick to go to what are risk and protective factors for victimization, and we'll be talking a lot more about this, but what we really are trying to explore with our issue is what are risk and protective factors for potential perpetrators. What puts a person at risk for being a perpetrator? What are protective factors that help a person from perpetrating? So we'll get into that in more detail, but
if you don't mind, I think it's really important not to get caught in the thinking that a risk factor is also a cause. That a risk factor is often highly associated with the phenomenon, but there's not a causal link. And often we get trapped into thinking that X causes Y. And that's not what we're talking about.
And that becomes particularly important with sexual and domestic violence, because often victim blaming is a factor that goes on. So it's really a fine line to talk about risk factors for victimization compared to responsibility for what happened, which is for the perpetrator. The third step of the public health approach to prevention is to develop and test prevention strategies. And what this is looking at evidence-based approaches to really have a scientific approach to what is it that we're going to do to intervene, and use things like needs assessment, surveys, stakeholder interviews, focus groups, to really be mindful about what we're trying to accomplish and whether it's going to do what we want it to do or not. And then the final step is to assure widespread adoption of our strategies, and that's doing the networking, training, technical assistance to, once we have this carefully thought through approach that we've tested, to be sure that we disseminate it as broadly as possible. And that kind of takes us to where we're going at the end of what we'll be talking about, which there's been a lot of work that's gone on in Ohio around sexual and intimate partner violence prevention, and we're now trying to be really mindful about how do we approach statewide implementing what we're finding to work. Okay. So with prevention, from a health perspective, we talk about tertiary, secondary, and primary prevention. Tertiary prevention is what you might think of first with something like sexual assault. You might think of getting the survivor into counseling, getting the perpetrator into some kind of treatment program. With batters, we have batter treatment program for domestic violence. So that's taking a crime has occurred, the violence has already happened, and we're going to see what can we do to help the victim and the perpetrator to keep this from happening again. Secondary prevention would be after the sexual or intimate partner violence has occurred in a short-term basis, that we want to get the perpetrator off the streets, we want to get the victim some support, we want to get the domestic violence survivor into a shelter. Again, it's to keep something that's already happened from happening again. And there are a lot of strengths of doing good secondary prevention, because we do know that people that have been victimized once are at increased risk for repeated victimization. And again, that's not because of anything they're doing wrong, but because there's things about having been victimized that do put you at increased risk. So secondary prevention is also important. But with the work that we're doing, we're really trying to move as much as possible while still doing the other kinds of prevention, but moving, because it's also very difficult to do primary prevention, but to put our efforts to doing primary prevention, which has the wonderful advantage that you're stopping violence before a victim is created, before violence occurs. You're also stopping the potential negative effects on the perpetrator. So it helps everyone to stop the violence before it starts through primary prevention.